morning and welcome to Open Mics with Dr. Stites. No, I am not Dr. Steve Stites. I'm Jessica Lovell. Dr. Stites will join us here in just a moment, but we are live right now inside the Dolph C. Simons Jr. Family Broadcast Studio. Coming up today on Open Mics, getting the word out during the pandemic. It is something we've been doing for the past 2.5 years. Dr. Stites and Dr. Dana Hawkinson have been committed to bringing you pure, unvarnished medical facts and the truth about COVID. And you, of course, our loyal viewers, have responded and been grateful. The medical community has also taken notice as well, and we're going to talk more about that this morning. So please get your questions sent in to us today on YouTube, Facebook, and the Medical News Network. You can find links to those right there on your screen. So where in the world is Dr. Steve Stites? I know, he is live inside his hotel room in Las Vegas, Nevada, where it's a little early. It's 6 a.m., but we're fine waking you up that early. How are you?
I am great, thank you. I'm happy to be broadcasting live with you from the Dolph Simons from the Wynn Hotel Studio, also known as...
A little jealous, I have to say, but it was needed.
You're
what's that?
You have a history in Las Vegas, I'm just saying.
I do. I lived there for 10 years, so I miss it, but I'm glad you're there in my stomping grounds, taking good care of it. You are there for the Vizient Connections Summit. So tell us why you are away from us and what you are doing at Vizient and exactly what is that?
You know, Jill, I think, Jess, good Lord, sorry about that. One of the responsibilities of being an academic medical center is you have to disseminate knowledge. You can't just try and do good works. You have to try and talk about those good works so others can learn from that. And what Vizient Summit is lots of major academic medical centers, as well as strong community hospitals that have residency training programs and other things. And they come together and we share information. And one of the things we wanted to talk about was what we have done on open mics, or what we did on the morning medical update, or back when it was the morning media update, because I think that's really important knowledge to share. And so we are telling others about how our program worked, what we've done over the years, how it's gone, the things we did, how we worked in the community. So I think we're trying to disseminate that knowledge so that other places can hear and learn what we did, so they can maybe develop the same relationship with their community that we have with our community.
I'm hoping you can see this old video that we're showing. I say old, it was 2.5 years ago, Dr. Stites, when we first started. I mean, we joked that, first you guys were huddled around the phone, then we were all scrunched in, everybody was scrunched in around our table here, and just as things started to evolve so quickly, they changed. I mean, now we're looking at your chief medical officer conferences that you would do weekly, gathering everyone in the community. So just talk a little bit about that. Kind of what do you remember from that?
I'll tell you, that I think was some of the best work we've done. One of the things we've said along the way is that we can't be flapjackers, right? You can't flap your arms and jack with the truth. And along what that meant is you had to find your voice. I'm going to quote Star Trek now. That should surprise absolutely no one. Live long and prosper. But there's this line in Star Trek where one of the Captain Burnham, they were complimenting. They said, "You taught us. You had to wrestle with how to be. We had to wrestle in this program with how to be. How were we going to send our message? How were we going to talk with the public?" And you all knew that because you guys are more professionals. I'm just a silly doc with looks terrible in that white shirt. Do not use that T-shirt picture right there again. Yeah, please. And so in trying to wrestle with how to be, one of the first things you had to remember is we had to be true to ourselves and our own identity, which is that meant we had to stay in our lane. So I think one of the most important things we did was we really stuck with medical stuff, the things that we knew and we could talk about. And we tried to always tell the truth. Why is it Hawkeye gets the cool shot? And in doing that, one of the things I think that helped us do it is that by really focusing on the medical news and staying calm about it and not trying to scream and shout about it, I think we attracted people who wanted to hear a calm, honest conversation where it was okay to say, I don't know. And we talked about it all year long. We were building the airplane while we flew it. When we wanted to talk to the community at large about saying, hey, folks, we're really in trouble, we wanted to expand our voice beyond just Hawkeye and I. And so over the course of the pandemic, we had developed this relationships because we started holding chief medical officer calls for our community and our region, sometimes 3 times a week at the highest point. So we could exchange ideas. Sometimes we had to exchange ventilators. Sometimes we exchanged vaccinations. We really went out to try to help each other. And I'll just tell you, I think that was a great spirit. It was absolutely the right thing to do. And when we had those chief medical officer calls, what we were really saying was, look, Kansas City, look, Kansas, look, region, we're in trouble and we need your help. And your help meant we needed you to help us get masked, keep our distance. And because back then, we didn't always have effective therapy and we didn't have vaccination for a good part of this pandemic. And by trying to reach out to the CMOs, we made the truth everywhere. I think, truth may be truth, but it's really true when it's local. And so people had to feel it locally. And so when we talked with Salina and Topeka and St. Luke's and HCA and all the other hospitals, North Kansas City, Liberty, Olathe, the Kansas City Veterans Hospital, Advent Shawnee Mission. I mean, when we started talking with all the hospitals in our area, with all the leaders, Lawrence Memorial Hospital, what ended up happening is people, I think, heard that message. And then we started working with politicians and with political leaders and business leaders. And I think we helped rally the community. If there's anything we're proud of, I think, on our program, I think it's that we helped rally the community to keep people safe at a time when there was a lot of mis and disinformation about the pandemic.
If you're just joining us, Dr. Steve Stites, he's joining us from the Vizient Summit Conference in Las Vegas, Nevada. We've been kind of taking this trip down memory lane because you're going to be giving this presentation today to other academic medical centers around the country. So tell a couple things. Why should the public care about you and these other, our place and other places around the country coming together and sharing their information? How does it affect patient care and the public? It's not open to the public, but kind of take us inside what y'all are going to be talking about.
You bet. This is like other scientific meetings, right? Scientists can come together and share information and talk about their research findings that help folks develop new ideas, new therapies, new drugs to help save lives. What we're trying to say is, hey, academic medical centers, find your voice and don't be afraid to take a public stance with your voice. One of the things we did, Jess, we were really honest. If you look back on our program, think about some of the things we did. First of all, we told everybody about what our COVID numbers were. We told how many people were dying in our hospital. Hospitals don't like to do that. They don't like to admit that people die because when you do that, it makes people feel uncomfortable. But we took a completely different stance. We said, what we're going to do? We're going to tell the dark truth. We're going to say, here's how many people died. Here's how many people are surviving from COVID. Here's the story of those people who died. And we actually talked about individuals who passed away, and then we brought their families in. And what were we trying? We're not trying to scare people. We're trying to teach people. Just as we try to teach a one-on-one, when I have my clinical practice, I've had the great honor and pleasure working with the same nurse for 20 years, almost 20 years. I'm not sure she would say it was a great pleasure, great honor. But beyond that, we sit down and we talk with our patients, and our goal is to be honest and to tell the truth, but also to give hope at times of difficult diagnoses. And I think when you're in a time of great crisis, the voice of an academic medical center, especially when you combine it with all the other hospitals in your area, can be a source of hope to know that this is what you can do. This is how you can stay safe. These are the ways we can work together. You could say, well, one hospital could do that for the whole country, but it's not true. That's just not true. What's important is that local voice. It's like the local news. And people tend to respond and believe the folks that are in their community. And I think that's a really big and important part of our program, is that we did that. And that's one of the reasons we talked about reaching out to all those other CMOs. We pulled them in from communities all around us. So I think what we're trying to say to others, just as we teach about science, we teach about research, we're trying to teach about communications and how to talk and be an important part of your community with your voice. And who better than an academic medical center to help lead that?
And Dr. Stites, you and Dr. Hawkinson, really pledged from the very beginning to stay in your medical lane. And I know it was hard because we were pulled politically from one side to another. And so many questions when here you are giving facts and science, and there were so many questions around that. You'd never been questioned in that way before. And I think that is where we went to a new level of show me the science. That is kind of where we are now, where we're having to actually break down the science about the vaccine, about the medicine, about the, show me the science behind the truth. Talk a little bit about that and how you think that is helping us better communicate with the public.
Yeah, isn't that true? It is hard to believe. If we turn back the clock, do you remember the debate about ivermectin? I think it's kind of dead now. But people wanted us to come debate in big public forums. And you remember, Jess, I wanted to go take it on. Let's do that. And, that's kind of my nature, I guess. But you all said, no, you can't do that. You have to stay above the fray and just keep telling the truth and being honest about it. And we realized that what we had to do is we had to talk about the science so people would understand why we knew that this was true and how we would teach about that. We would review real information instead of somebody who may or may not have been paid to say something and just talking about stuff. Maybe they had one or two patients. Oh, hey, look, this is what happened. That's not science. Science is when we, in a dispassionate way, look at information, review that information, and talk about that and show everybody the information. Oh, sorry about that. I hit my little thing there. And so show me the science says we're going to teach people how we do it. We're going to teach them the terms. We're going to show them all the information. We're going to try and bring you along to see the world like we see it in the ways that we see it. Because medicine science, because its very foundation is based in trying to help and save lives, has to be brutally honest about our successes and our failures. And when we don't, we should be heavily criticized. And so we try to be brutally honest about all things around, the new therapies for this pandemic. And I think that is a critical part of Show Me the Science. It's a critical part of open mics that we try and tell everyone, this is the real information. Here's how we're interpreting it. Here's why we look at it that way. And here's the decision you get to make. So I take it back to ivermectin. Remember that very first Show Me the Science program? We're not going to debate in some public forum that's kind of jury-rigged. We're just going to do it as we would at what we call an academic journal club. We're going to go through the data, we're going to have that discussion together, and we're going to show you all the information that's out there. And then you, as a patient, have to make the decision. But we're going to teach you how we look at it so you can best understand the information and make your own best choice.
Dr. Stites, you are always, in my opinion, someone great to talk about it, because two things I know about you: you're a man of faith and you're a man of science. And you've always said that faith, hope, and science all intersect. They can all live happily together, right?
Absolutely. I'm glad you brought me back to that. I was going to go to that a minute ago. Now you just took me there. Right. Faith, hope, and science. How many times do we end the program with that? And I think it's true. And I'm going to say that today here in Las Vegas. The intersection of faith, hope, and science is a powerful place. And each of us has a faith of our own. And mine is based upon how I was raised as a child, and in the First Presbyterian Church in Independence, Missouri, a Community Christian Church now. Hi, Shanna Stites, if you're out there. That's our minister. And if you take faith and what you believe in and hope, because people have to have hope. I learned a long time, very early in medicine, the power of hope. I had a patient a long time ago who came to and I say a long time ago, maybe it felt like it was just yesterday, but it was about 15 years ago or 20 years ago. And a new medication for pulmonary hypertension had just come out. And this patient was referred over to us because we're the only ones at that time that it was brand new, and it was experimental or under investigational still. So we're the only ones in the cancer who was doing it. We're doing the therapy. And she came to us and she said, they told me that I was going to die. And I said, not yet. Let's talk about maybe what we can do instead of what we can't. And I remember, and she's a minister as well, and she said, the most important thing you did for me that day was you gave me hope. And it's not false hope. You have to be honest. You have to tell the truth. And sometimes you help patients die as well as try to help them survive. But hope is powerful because it allows folks, and I took care of patients with cystic fibrosis for years, right? You try to instill hope in people that science can help advance us. So they'll do their therapies. They'll try this new therapy for pulmonary hypertension. They'll try to be aggressive with their airway clearance and cystic fibrosis. And here's what we know. That therapy for that one patient with pulmonary hypertension, she survived for 5 or 6 years like that and did okay. And then when it got worse, she has a lung transplant. And now, 20 years later, she's doing great. Our patients with cystic fibrosis, who we tried to talk to for so long and say, listen, we got to get you to exercise. You got to eat right. You got to do this airway clearance. You got to do all these inhalation therapies. It took 2 or 3 hours a day. Imagine finding 3 hours of your day, maybe sometimes 6 hours of your day, just to try and make sure you could breathe and take, how can you have a family? How can you have a job? How can you have a personal life? And now we have a new therapy for CF. And it's remarkable. And people are going to live to be a very old age. Well, hope, faith, hope, and science. When you put those things together, you can really help folks. And that's what we tried to do in the program when we're talking about, look, there is hope out here for COVID-19. And now we've got Paxlovid, right? We've got new therapies for inpatients. We've got a whole treatment algorithm. I mean, and we got vaccination. So many people live today that we're going to have died at the beginning of this pandemic. And it's powerful to me how far science came, how fast. And it's powerful to me that people had faith that we can get there, and they had hope. So the intersection, faith, hope, and science, powerful, powerful medicine.
I want to talk to you about something else, Dr. Stites, and I was just reading a comment from Kelly. She said, I counted on your program throughout the pandemic for the honest truth and advice. It helped keep my 85-year-old parents healthy and informed because of you. And I know you don't like to take the credit. I know all that. I know you like to credit the team, but they did look to you and Dr. Hawkinson for that information. So just emotionally speaking, I just looking at these videos and going back and seeing where so much new information was coming in day to day, hour to hour. I mean, we said that hour to hour, really. And so to see us trying to figure it out along the way to these videos of you getting the vaccine. I mean, it kind of gave me a little bit of an emotional feeling, and I kind of want to hear the emotion behind you to kind of watch this in real time in pictures. We have it documented of how this has kind of all evolved and how you two were, you know, like if you could see right now on your screen, you know, I know you love that. I know you love that video of you in your white T-shirt, but.
Yeah, I'm shaded T-shirt colors. That's what I'm doing right now.
So just emotionally, what has this been like for you?
You know, gosh, it's professionally, it's been the greatest work that I've ever had the honor to be a part of. And on a large scale, I mean, the work we do in our clinical practice is the greatest work in that world, in a different world, right? That's in my clinical world. But if I go out of the clinical world for a minute and say, what's the greatest thing you've been able to do in this kind of administrative professional role as opposed to my medical physician role? It's been an honor to be a part of it. Look, we have a great team, right? I look at Logan or Anthony or Cliff or Mike and you and Jill and everyone that has been such an important part of this program, that this could not have happened without them. I'm just a goofy kid from Independence, Missouri with really big ears that look like they could fly away at any minute and a little sag under my chin. And that's just who I am. And so look at those pictures. One of the things I'm reminded of, Jess, is that along the way, we were able to have fun. I think that was a big part of the story, is that faith, hope, science, and then have a little fun along the way. Make a little noise, right? Make a little noise. And I think that we were trying to take care of people. We're trying to help them get through what has arguably been the greatest healthcare challenge um, of our generations, and certainly of my career. I talk a lot before about HIV and AIDS, and the difference with COVID is you had a lot less control over contracting it, and so more people were getting it all at once. We're just trying to help keep folks safe and do the best we can with the knowledge we can. I know Hawkeye and I both would read articles every morning to try and be prepared, to make sure that we were telling you the most up-to-date things. And then we would, and there just can't be a better partnership than with the Hawkeye. I just can't tell our eyes how much I respect and love that guy, because he has been such a stalwart, such an anchor for us. But we
Dr.
would call
Stites.
Yeah.
He's here. He's in the building. You can thank him right now.
Hey, brother. How are
Thank you. Hi. Yeah.
I was just saying, I can't tell the world what a great, anchor and touchstone you've been, because you've been rock solid the entire time. And I think that relationship helped. And I believe that it made a big difference for how we could respond to folks. The last thing I just say, I know he and I would each read in the morning, and then we would compare notes. Hey, did you see this? Did you see that? I'm going to ask you about this. Let's talk about that. And it was good. And we had to learn a lot along the way. So.
We've been going down. Oh, I'm sorry, Dr. Stites, go ahead.
No, I just said it's been an honor, right?
Yeah.
It's an honor to be a physician because you get to take care of people. It's been an honor to be on this program because we got to help take care of a community.
And you guys did it together. And we all appreciate you as well. And Dr. Hawkinson,
Yeah.
I know you dropped your daughter off at school,
Yeah.
so thank you for being here, because you missed out. We're going to roll some video because we've been going back. Dr. Stites is in Las Vegas for this Vizient Summit conference, where he's going to be presenting and talking about what you all have been doing over the last 2.5 years, and the communication and this unique way of reaching our community and educating them and giving them the facts, and that you two have stayed in your lane, and that you are giving factual information and answering those daily questions. As simple as they seemed, our community needed to know them. So another thing that we were always doing every day was sharing our numbers. We still do. I'm going to ask you just to jump in and share our numbers today.
Yeah. Well, I'm certainly humbled and feel so proud of what Dr. Stites has said. And for me, it's been good to really, develop that relationship with him over these past few years as well. So I've known him since a resident, but certainly in a different capacity. So that has been a real good thing for me. And I was even talking about that this weekend. But I'd also like to say, you mentioned Vizient. We are here. He is there for Vizient. I would also like to say a big part of that is the IPAC team that I work with. Yes. So Amanda Cackler, Lance Williamson, they are rocks and anchors here for the health system, for you and the patients here and their families, to help keep them safe, so that we can do everything that we can do to prevent further complications when you come into the hospital. So I want to give a shout out to them as well.
That's our infection prevention and control team, correct?
Yep.
That you work along.
Prevention and control. Yeah.
Fantastic. Numbers today. Let's talk little numbers, then we're gonna go back and talk more.
Yeah. So active in the health system here, 32 active infections, with 2 in the ICU, 2 on the ventilator, still 26 in that recovery period. Again, I think we've been remiss as to not fully understand exactly why we still have so many in the hospital. We know nationally the reported cases are going down, so are the hospitalizations. What we do know from what we have been seeing through these past few months in looking at our patients, though, is that the vast majority of them are either not fully vaccinated, haven't done any vaccination, or again, not up to date. So I think that continues to be that theme that we are seeing.
I'm just reading some of these comments, Dr. Stites, too. Kathy says, I've loved this show from day one, still listen every single day. So it's so nice to know that people didn't stop listening, that there's still good information out there to share. So I'm just going to kind of pass these along to you throughout the show. But I wanted to show, we got to talk a little COVID. I want to show that heat map that you like to talk over. Just explain, when we see that, what are we seeing?
Yeah, I hear we're seeing some good news, right? The numbers continue to fall throughout the country almost daily. We see it's down. This percentage of the rolling 7-day average continues to decline. You see the light yellowish zones. Unfortunately, that's one of the places I am in Las Vegas. It's pretty lightly colored, or at least Nevada overall. And then you see the darker red spots that are done by county, and they still represent hot spots. You can see out in Kentucky, West Virginia, a little bit of Southern Ohio. There's still a little bit of a hot spot there, but across the country overall, we're doing really well. And I say really well. We still have too many COVID patients, really well, but we still have 35 or whatever, 32 patients with COVID acutely in the hospital. But we're better than where we were, and we hope it stays low as we enter into the fall and we enter into the cold season. I think the big concern, you always hear it from us, is when people go back indoors, and if it's been a while since they've been sick or they've been vaccinated or they haven't been vaccinated, that's when trouble can happen. And so while the heat map looks better, and the best heat map would be if everybody had gotten their booster shots with the new bivalent vaccine. And Hawk, just to say, I think that some of the information looking at the immunity seems to look good on the new studies that came out in the last couple of weeks here that were in the New England Journal of Medicine. You've always said, and I think brilliantly so, the T-cell response is probably the most important, and it keeps us out of the hospital and it keeps us from dying. That's been a really good thing, and it's been consistent with vaccination across the board, which is a remarkable statement how good it is. But this advance with the bivalent vaccine may help a little bit more with some disease prevention. So I'm pleased with some of the early information we're seeing come out and that was published during the last week.
A couple of COVID headlines, Dr. Hawkinson. CDC issuing a chart to help people prevent from mixing up the first 2 rounds of shots. How important is that to have that? We've talked about that it was okay to mix some, but then after you've gotten your first 2, you want to stick with it. Why is this helpful?
Yeah, I mean, right now we still have the monovalent. That original vaccine is really going to be used for that initial vaccine series. After that, you can certainly go to the booster because that would be a booster. You need to complete that primary series, though, as it is, and so I think that's important to understand. And again, I feel that probably most people who have wanted the vaccine has probably completed that primary series. But again, we know as children get into that age where they are able to be vaccinated, that is also one thing to consider, is that at this point in time, you're still going to be using that monovalent, that initial vaccine for that primary series.
All right, I want to ask you about something, kind of a sad statistic. Journal Nature reports more than 10 million children have lost a parent or caregiver since the pandemic began. Just want to hear your comments on that.
Yeah, I mean, I think it's unfortunate. I know people I know, a father had died and still with the young children. And that is also, even in our country, that is a huge number. Not only losing one parent, but we know that there are children who are fully orphans because they've lost both parents as well. And so, this pandemic, this virus, this disease has just taken a lot of lives, has created a lot of problems and complications in people's lives for one reason or another. And probably the most impactful, again, is losing that loved one, especially losing that parent.
And then just lastly, for those trying to get the new bivalent vaccine. Oh, Dr. Stites, did you? I knew you'd want to comment on that.
No, I did. Remember that we're all children, right? And we're children for all of our lives, I think. And it would clearly a huge impact on very young children. I'll remind our audience, early on we interviewed one of the interpreters who is on our program who lost both their parents from COVID-19. And so this tragedy can happen at different points in your life. And back to the earlier question about vaccinations, it still can, right? Don't go unprotected. The science around COVID vaccinations, it's so safe, and it's so strong, and it's so effective. It's so much better than the influenza vaccine. There is no question how to make sure that children do not lose their parents. The answer is, let's get vaccinated.
Well said. For those trying to get the new bivalent vaccine, though, Bloomberg reports Moderna booster shots are in short supply in U.S. pharmacies. Is that an issue here at the health system or at pharmacies even in our area or region?
Yeah, I mean, certainly at the health system it is. I've been talking with Adam Meyer, again, who we all know from the show as well, helping, being one of the leaders of the vaccine effort here at the health system. We have a short supply. I think we are nearly running out. We aren't able to order more at this time, but we do have plenty of Pfizer. And going back to that original chart and just understanding, if you are in that booster phase of your vaccination, meaning you've had the primary series, and then had 1 or 2 boosters or no boosters yet, as long as you've completed that primary series, you certainly are able to mix and match. So if there is no Moderna available, even though you had Moderna for your initial primary series, you are able to get Pfizer if you're needing to be up to date with that vaccine series. So I think it is important to understand that in that case, you can get Pfizer, and that should be fine. I think we do expect, from what I saw, the Moderna should be back online in a couple weeks. But I think we also need to talk to the point that the reason from what I understand, the reason the Moderna plant shut down was for FDA regulatory reasons. And this goes to another thing that Dr. Stites had been talking about since the beginning, the extreme consciousness that the FDA has taken to ensure the safety and the proper regulatory steps are made with these vaccines as well. This is one more indication of that.
Do we have any reporters on the line? Oh, go ahead, Doc.
Yeah.
Yeah.
And I think to Hawkeye's point, dead on right, but also remembering that I think what was going on is Moderna has a new manufacturing facility that had not finished getting its regulatory approval. I don't think they had a problem. I just want to be clear, I don't believe they had a problem. I think they just hadn't been opened yet. And so as a result, they hadn't made enough of the bivalent vaccination.
Any reporters today? Well, let's get to our community then. Paula wants to know, is the 5th vaccination out there already, or is there a different timeline? 5th vaccination, would that include a booster? What might they be referring to?
I think the CDC really tried to simplify that, because we know there have been first an initial booster and then a second booster if you, say, are over 50. Right now it's basically finishing the primary series, and once you've done that, you are eligible for the booster. Whether that is your first booster, because we know some people didn't get it, whether it's your second booster, we know some people didn't get their second boosters even though they were in that criteria. So we understand that really it's just completing that primary series, and then as long as it's 2 months or more after that, or if you've had a booster, if it's 2 months or more after that booster, you are able to get now this new bivalent booster, hopefully to give you protection for any possible upcoming surges and through that respiratory viral season, which is going to be the fall and winter.
Sue wants to know, I want to get my second COVID booster shot and also my regular flu shot.
Yeah.
That's good.
Yeah.
Should I get one before the other? How far between should I get them? Dr. Hawkinson, I know friends and family who have just gone and gotten them right on the same day, one right after the other. That's okay?
Yeah, it's pretty clear you can get both of those vaccines at the same time.
Gotcha. Okay, Dr. Stites, I'm going to start with you because Jerry has a question for both you and Dr. Hawkinson. But who's been one of and I know our shows are like our babies. It's hard to pick a favorite, and our guests are all amazing. But has there been a favorite show topic, or who's been a guest that you maybe have been just enlightened by? Could you just over the last couple of years, could you remember back one or two of your faves?
Yeah, first of all, someone
and Dr. Stites, I know the one with your daughter. Your daughter's been on several times, so we already know those are your tops.
Yeah,
we get that.
That's obviously the number one. You bet that would be the best program, because she's the best. All my kids are. Dr. Greg Poland from Yale, I thought he did a great job. Hawk, you brought him on the program, and I thought that was outstanding. And I think that may be my favorite program, because he knows so much. He speaks with such knowledge. And I think it was such a great voice to hear in the midst of all the ridiculousness, all the people who were flapjacking, the ways we do it. So those may be some of my very favorite program. And to be honest, I think one of our best programs has been the first Show Me the Science, where we went through the debate about ivermectin, when that was such a hot moment. And we just man, here's the truth. Here's the data, folks. You make your own choice, but here's the real information. And as we said to our audience, we're not paid to say one thing or another. We're just paid to tell, we're just here talking, and we don't get paid more because we do this program. And so we didn't have any financial motivations or anything. And I think that Show Me the Science has been really, really, really good.
I think so too. I think our audience has appreciated you giving the information, but then just going several layers deeper to explain it even better to people like me who do not understand the terms. You know, I can't even pronounce most of the terms, so we appreciate that. Dr. Hawkinson, what have been some of your just maybe memorable moments or things that you remember most from the show?
Yeah. You know, I think for me it is dealing and listening to our local partners. So obviously Wyandotte County Health, we know we've had several members from the Wyandotte County Health Department. We also, have had Dr. Greiner on, who works closely with them, also with our health system. And then it's also our partners on the other side of the state line, because we are all this community, and just understanding and letting the people in the community know that we are all working together for this. And I think there has been a very good push and a team effort to do that. And a lot of that was brought on by Dr. Stites here, helping to organize the CMO calls as well, where we're able to hear the CMOs from different hospitals around the area and see what they're doing, what their status is. So I think that has been good to help inform the people of our community as well.
Couple more questions, and then we're going to get. Oh yeah, go ahead, Dr. Stites.
Yeah. So, and here I'm rocking again, just to make sure everybody knows I can still do that. I think those CMO calls were great because the CMOs themselves did such a nice job of rallying around the truth. And, we are fiercely competitive, and you can see it on all the billboards that are up, right? We're fiercely competitive as hospitals. But the reality is we are in the same boat, and that boat is about trying to take care of people. And I think when the CMOs came together and just told the truth, I think that was an especially effective moment. And I think it made a difference in the community. And when we worked with political leaders and we worked with business leaders, and we were all on the calls together, and we said, here's where our communities really are. Get away from all the junk and all the silliness and the silly stuff. But let's put all these voices together, and let's hear whether it's Dr. Antonios down in Wichita, or the good teams at Stormont Vale and St. Francis, or all the good folks here in Kansas City, Salina, Manhattan, Hayes. I mean, we went all across our region, and I think that was a really important voice.
No, it's very powerful. I think seeing all of your faces saying the exact same message, echoing what one after the other said. So everyone's on the same page. It's not coming from one mouth, it's coming from everybody. So that was really, really important. I do have a couple of questions. Dr. Hawkinson, Shanna and Marta have similar ones. How long after getting COVID can I then get the booster? How long do I have to wait till I feel better?
Yeah, I mean, I think, there's been kind of loose recommendations, different recommendations. Again, early on when the vaccines came out, it was, you can get it immediately after you're out of isolation. I think what most experts are recommending now is waiting that 8 weeks to 12 weeks, so that's 60 to 90 days. We know the risk of reinfection is low within 90 days. It's a little bit higher probably with BA4, BA5, but you are still going to have that boost, that immune response for that natural infection. So I think probably the best practice is going to be to wait 60 to 90 days after this recent infection, where you can get the booster after that. And I think the main reason for that is right now there are no variants of concern on the horizon. And right now we also know that the circulation of the virus, although still pretty high, is decreasing as well. So I think waiting that 60 to 90 days is going to be important. And if you've had it recently, that means you're going to push your booster dose really to a little bit later in this fall, and that's going to probably provide you maximal protection for that holiday season moving forward as well.
Last questions from Fanny.
Yeah.
She said, my partner took the third booster Monday and has been dealing with a massive headache. At what point is it vital to seek medical attention?
I would say your body better than anyone. Is the headache related to the vaccine? Were they just coincidental? I think that's one thing to understand. Understand, is it getting better, is it getting worse, and really just know your own body and how you're feeling. And at that point, if you need to seek medical attention, I would do it at that point in time. it.
All right, we're going to get to our final thoughts today. I'm going to let you get us started. Just any message about COVID, and certainly message about just the partnership that you've had here on this show. And I have to say, so many times I've asked you, I've said, I know you're super busy, so if you ever needed to miss a day, if you want me to do the numbers, I think I could fill in for you. And you're like, nope, I got this. So you've never backed out.
No, it keeps me on my toes. And just as Dr. Stites said, just about all the reading we were doing and continue to do, just to try to stay up to date, to be able to answer those questions from the community, because they are so relevant, so vital. Very good questions about boosters and infection and all that. We know the basics, though, the basics of infection prevention: washing your hands, staying distance, do things outdoors, be in well-ventilated areas. Individual prevention: be up to date with your boosters. Just as Dr. Stites said, that we have a wealth of knowledge of data to support the fact that, number one, these vaccines are safe, and number two, they do reduce your risk of hospitalization, severe disease, and death. And it's just as we pointed on in that one point about how many people have been lost and how many children are without maybe now a caregiver or a parent. It's so vitally important to stay vigilant, stay up to date with your boosters, to keep your individual health as prime as you can be. And would just like to leave it with that.
Great. Thank you so much for the work you do, the work you continue to do, and just being inside this studio every single day for the last 2.5 years. So thank you.
Yeah.
Dr. Stites, I want to get to your final thoughts, but before you do, just explain to people where you are, what you're going to be doing a little bit later today, maybe after you get a little nap in this morning.
You bet. Yeah, I'm in Las Vegas at the Vizient conference. Vizient is a group of hospitals and health systems from across the country that tend to be some of the larger academic medical academic medical centers, as well as some very large community health systems that come together and exchange information on best practices. And we're talking about the morning medical update and just trying to do one of our responsibilities, which is to disseminate knowledge. And by doing that, we're trying to say to folks, hey, you can do this locally too, and help your community stay healthy. And I think that's really why we're here. Just what I really want to do is say thank you. I want to say thanks to you, to Hawk, to our interpreters, to our studio team, and of course to our audience, and all the great guests and folks we've had over the years. This has been an amazing journey. And we are deeply appreciative and feel very much that we have been graced by others to help us have and hold this program. Our work, I think Hawkeye and would both say this, our work is to try and help people stay alive and get better. And we hope that this program has done that, and we will continue to do it. We won't hopefully always talk about COVID. There are a lot of things to talk about in medicine and healthcare, and we want to do it as a community with all of our audience as part of that community. The intersection of faith, hope, and science is a powerful intersection. And when you have a community who's working together to understand that and listen to it, that's when we can really help a lot of folks.
Dr. Stites, I guess I'll have the final word. Live long and prosper, my friend.
And prosper.
Am I doing you right by sitting on your desk on open mics with?
Oh, well done.
Got it. Okay. Be safe in Vegas. Have a great time, a great talk today, and we'll see you back here next week. Okay.
Thank you. See you soon.
Thank you, everyone. Thank you so much for being with us today. We'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update, more than 12,000 women will die from ovarian cancer this year. The good news, the FDA has approved 4 new drugs in the past 3 years to help treat it. I'm Jessica Lovell. Ovarian cancer often goes undetected. Thursday at 8, how to better spot the signs. On the next All Things Heart.
I gained 80 pounds in 6 months.
No matter what she did, the weight piled on. The danger to her heart that prompted her to get a life-changing surgery. Bring your questions. We'll see you at 10 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.